Alright, here is my final presentation for KRS 484 by Taylor Troyer. So here my issue is drug abuse within youth. And a little bit of background information on this issue. Drug abuse in youth is an ongoing issue that young adults, teens, and younger kids suffer from and/or witness. Most adolescents who partake in doing illegal drugs early on have a higher chance of ending up addicted to drugs later in life. Some common risk factors of experiencing drug abuse among youth is family history with substance abuse, mental health issues, risk-taking and impulsive behaviors, drug availability within the community, within reach for the youth, poverty, peer substance abuse. So a lot of those factors can really play a role in youth taking drugs, abusing the drugs, especially peer substance abuse. It's a lot of research found that the social pressure is real when researching that drug abuse patterns. Research also shows early aggressive behavior, lack of parental supervision, and academic problems can be associated with common risk factors of drug abuse in youth. Data and trends. So, about 50% of teenagers have misused a drug at least once in their lives. At least 1 in 8 teenagers abusing illicit substance in the past year. It has also been found that 1 in 7 young adults have a substance abuse disorder. It's also been found overdose deaths have increased by about 94% from 2019 to 2020 and 20% from 2020 to 2021 within people ages 14 to 18 years old. I found from the CDC back from 2020 in an article written, there is a high-profile public health concern for the amount of youth drug abuse. And in another article produced by UCLA Health, they share an average of 22 adolescents 14 to 18 years of age died in the U.S. each week in 2022 from drug overdoses, which raised the death rate for this group to 5.2 per 100,000, driven by fentanyl and counterfeit pills, new research finds. So I added this in my presentation, pretty much just sharing an exact example of how drug abuse can really affect the community, especially within youth. So for some statistics, there's some big numbers. This statistic I listed here is 22 teens died in the U.S. each week in 2022 because of drug abuse-related overdoses. So that's pretty similar to what I listed here with the fentanyl, just a related issue to show the significance of that. And here's my program that I created. It's called Habits. Creating impacts and habits for youth is like the main purpose. A little bit about Habits. So Habits is a program created to help make an impact on the amount of drug abuse occurring within the youth community. The program works to help teens and kids struggling with drug abuse by providing easily accessible resources, as well as working with preventful strategies to overall lessen the amount of youth that is affected by drug abuse as a whole. The overall main purpose of Habits is to prevent and to bring a stop to substance abuse in youth. Program theory. So, in order to prevent and bring a stop to drug abuse in youth, there are desired overall results, influential factors, strategies, and multiple assumptions that can be made. For me, I realized that habits needs to be based off of the assumptions as well as the multiple factors, strategies, and obvious results that are needed. So for desired overall results, I stated that there needs to be a greater number of adolescents to not use illicit drugs, as well as less reported injuries and fatalities involving drug abuse within youth. Some influential factors that can be affected by this include community and home life, including friends and family, accessibility to resources, influences from media, social pressure, and help with prevention strategies from schools. So the main influential factor for me, I think, that habits would target would be influences from media and social pressure. Some strategies include widespread prevention education, whether that be within the schools, within the community, targeting whichever level of public would be desired for that, because it is a public health concern. Widespread prevention education, checking mental health, getting youth involved in activities that will help prevent the start of drug abuse, such as sports, arts, and after-school activities. Research has shown that kids that are involved in after-school activities or sports, or find lots of hobbies to spend their free time, are less likely to partake in drug abuse early stages of life, just because they'd be more busy, they'd have a more packed schedule, and they'd have more things motivating them, and they'd have higher determination levels than the kids that just went to school and then went home after, and then they have more time to get caught up within drugs. Some assumptions that habits will be based off of. Habits was created assuming that the targeted youth who is participating in substance abuse may be dealing with multiple factors such as mental health issues, living in a toxic environment at home, not feeling supported by family or friends, has a family history with drug abuse and not feeling motivated or have any self-determination for life or their future. Program implementation. So we have resources and inputs that talk about investing, supporting, accomplish, activities, outputs, outcomes, and impacts. So we have intention, change, direct results, short-term and long-term impacts. Resources and inputs. Here are some of these resources and inputs that I've listed. The main one here is that we need to support these youth for a healthy and happy mind. Activities will be based off of perspective. There will be substance abuse counseling focusing on why, how, and what is causing the drug abuse issue in the first place. The outputs here. So we will create a safe space for mental health resources for youth. We will have lots of strategies for achieving and maintaining health and balanced habits, ways of prevention at a community approach, as well as implementing prevention strategies within schools, households, community, because it is the public health safety concern as listed before. So here are some of the outcomes. The main ones will be the short term and long term. So short term is to make teens and kids feel understood and supported. We'll provide guidance for the youth to make sure they're making good choices and they're practicing positive and healthy habits that will be attained and practiced. Long term, the overall behavior and habits of youth will be shifted to positive, healthy, and clean without the need or urge to do drugs. Some of the impacts will be that the youth is supported by people who care about them and can help them. There will be easy access to multiple resources when in need. Youth will be educated in why or how they were stuck in damaging habitual ways. And drug and overall substance abuse in youth will become decreased. Here's all my references, and thank you.